Hi, good morning all. I myself, Dr. Tina Varghese, MC for today's event. It's with great pleasure and enthusiasm that I welcome you all today's event CPD on professionalism, the foundation of a successful practice. We have gathered here today to explore and celebrate an essential pillar of any successful endeavor. This event will surely mark a significant opportunity for all of us to deepen our understanding and commitment to professionalism in our respective fields. Now, I would like to welcome our beloved Dean, Dr. Ajay Talang, Deputy Deans, Dr. Kalyan Chakravarti, and Deputy Dean, Dr. Fawaz Siddiqui, and I extend my welcome to our distinguished guest, Dr. Faiz Ahmad, Course Director, Clinical, Oral and Maxillofacial Surgery, College of Dentistry in Imam Abdul Rahman bin Faisal University in Dammam, Kingdom of Saudi Arabia. I also extend a heartfelt welcome to our colleagues, students, clinical staffs, and admin staffs who play integral roles in our institution's success. Now, I would like to invite our Dean, Dr. Ajay Talang, to introduce our esteemed speaker. Sir.
Thank you, Dr. Tina. A very good morning, everyone. Respected Dr. Fayaz Ahmad, close friend and our external speaker for today, Deputy Deans, Heads of Department, uh, students, faculty, clinical staff, ladies and gentlemen. It's my privilege and honor to introduce Dr. Fayaz Ahmad, who is, as I mentioned, a close friend, a professional collaborator with us, as well as today's external speaker. So Dr. Fayaz Ahmad has finished his basic dental training way back in 2002 from Rajiv Gandhi Health Science University, Bangalore. He went on to do his master's in dental surgery in oral and maxillofacial surgery in 2007 from A.B. Shetty Memorial Institute of Dental Sciences, Rajiv Gandhi Health Science University, India. And then he also went on to secure his professional fellowship in university teaching and learning, which is awarded by Turku University, Finland, and Imam Abdul Rahman bin Faisal University, Dammam, in 2023. As an oral surgeon, he has worked in various different aspects of oral surgery. He has worked as a specialist registrar with the Department of Plastic Surgery, Global Hospitals and Research Center, India, from 2007 to 2010. And he is very passionate about cleft work in during that time. He was also the cleft coordinator and administrator of the Smile Train project with this institution for that duration. Thereon, he went on to choose academics as a career option and went on to become a lecturer with the College of Dental Sciences, Imam Abdul Rahman bin Faisal University, Saudi Arabia. And since 2011, he has been serving with the university in various different capacities. Dr. Fayaz is a notable reviewer with the Medical Education, Journal of Medical Education, Journal of Association, which is a journal of the Association of Study of Medical Education, and also is a reviewer with BMC Medical Education and other important international journals. He is a passionate teacher, a loving mentor, and has the opportunity to guide and train many different undergraduates and postgraduates in his career as of now. There's a lot in his CV. I think we will be running short of time, and so I'm going to cut the chase. And ladies and gentlemen, I would like you all to put your hands together. So please welcome Dr. Fayaz for his talk today.
A very good morning. It's my honor and privilege to be here at the Penang International Dental College to give this talk on professionalism. I'd like to thank the Dean and all those who have worked to organize this event for a topic which is very close to me, which is a topic which spans across different specialities, different areas of work. So I have essentially, as mentioned, worked with the division of plastic surgery. I've worked in different countries with undergraduates, with postgraduates, with different doctors in different specialities. But there is something common to all of this when it comes to success, when it comes to winning your patients over. So irrespective of our disciplines, we are essentially good professionals. And by saying that we are a good professional, we start off by saying that this is the foundation of practice. So in maxillofacial surgery, you have uh, a wide variety of procedures. You have a 3-volume book which speaks about these procedures. But the very first starting point is professionalism. What is professionalism? Professionalism, it has essentially been described in different ways. It's been described as attitudes and behaviors. The scope of this particular talk, in this short while, what I intend to do is to make everyone reflect, think, and see how they can incorporate professionalism in their daily practice, which will contribute to their success. So our learning objectives are going to be met from these two main resources, which is Fonseca, which is an acknowledged authority on maxillofacial surgery, as well as something very relevant to dental students, which is a publication on professionalism. So by the end of this session, we should be all able to discuss the 10 characteristics that make up a true professional. So the American Board of Medical Specialties has defined professionalism in a way which says that it is a belief system. It's a system in which group members like us, professionals, declare to each other and to the public a shared competency standards and ethical values they promise to uphold in their work, and the public and individual patients can and should expect from medical and dental professions. So what makes a true professional? The very first quality that makes us a true professional is that we put our patients first. We may have pressures as students to meet certain requirements, but we don't keep our requirements or our needs to learn over what are the needs of the patient. We do not keep our needs to do a certain procedure over what the patient actually needs. So we essentially put the patient first, and this starts by understanding and satisfying your patient's needs, which is the cornerstone of being a successful professional. So one, they put the patient first, and the others, they make everyone in the team feel a part of the success. They are good team players, great team players. Other members of the team trust them, and they make all members feel good about contributing towards success of patient care. So how does being a professional or being a non-professional affect your practice? Though essentially you have the knowledge and you have the skills. So if you look over here in a very good study, it said, does it make a difference if a person is a skilled surgeon but does not have good professional behavior? So what they essentially found was, with those professionals who had more workers reporting about issues with them, the outcome in patient care was poorer. Now, let me give an example of how this simply happens or translates when we are in practice. If I have a mindset where I'm willing to listen, I'm very receptive, everybody in my team is going to communicate with me. And if there's any shortcoming or overlook or slip, they will feel free enough to tell me. So I may be having a nurse or a dental assistant and I may have missed something. And if my communication channels are open and I'm a good professional, they will not hesitate to communicate and tell me and to resolve the issue before there's a consequence. If I'm an authoritarian who says, I know what has to be done and this is not what you know, then small slips will happen. And that's what they found out in this particular study, that where unprofessional behaviors increase the risk of medical errors and surgical complications. So this is coming out from the Vanderbilt Center for Patient and Professional Care. And this concept of making medicine kinder, safer, more reliable. We're at a time of technology where we've become technologically advanced. We've got much more facilities available, but that kindness in healthcare seems to have been affected. We seem to be delegating our patients more to machines and labs to give us the results when the patient actually wants to be heard. Sometimes just the patient being heard helps them feel better. So this is the words of Mr. Marriott. And he said that if you take care of your people, they will take care of your customers. That means if you are good to the ones employed with you, if you are good to the ones who are working in your team, all this will contribute to better care and better outcomes for your patients. So in other words, you are an excellent doctor, an excellent dentist, an excellent surgeon, but the person who receives your patient at the reception is grumpy. Your assistant is rude. So all this team members, they contribute to the overall experience of your patient. Apprehension, uncertainty, waiting, fear of surprise do the patient more harm than any exertion. Very well spoken, apt words by Florence Nightingale. Second, so I'm listing these 10 qualities that make up a true professional. So the first quality is they put their patient first. Second, they make expertise their specialty. They learn everything that there is to know in their specialty. They keep themselves up to date with the current classifications, the current way of managing things. Because we are at a time where patients read up about their conditions, and sometimes the patient may know even more than the junior doctor. So you may need to know what is exactly happening in the field and all developments that take place in that field. A true professional always does more than expected. Always deliver more than expected, famous words of Larry Page. And I'm so proud to be a part of this community of healthcare professionals, because we have always been doing more than expected. We saw it during the pandemic, where all healthcare professionals rose to the crisis and they served the community much more than expected. And as a healthcare professional, you are a true hero. A small note of appreciation to those who work with you. A person who feels appreciated will always do more than what is expected. Appreciation could be a simple sticky note stuck on their table the next day morning, which says thank you. It could be a small letter with a few words, which shows that their work is acknowledged and what they're doing is appreciated. You're building confidence in your team members. You're making them feel a part of the success. Do what you say and say what you can actually do, which means walk the talk. So sometimes patients come seeing something on television and you believe that it can be delivered, but we know the reality of the situation and we know how much we can deliver. That's the reason why we should be telling them what is possible within our facilities, within our scope of practice, with our skill set. We mustn't, because if somebody is going to see this and think that they too can have the same results, whatever you do, even if it is excellent, it will fall short. It will not do more than expected, because you have made the patient expect something far beyond their reach. But if you kept them in realism, it is highly likely that whatever you do, which is going to be a little better because you're going to give your best, is going to be more than what the patient expected. So do what you say and say what you can do. And of course, there are situations which are way beyond your control, actually beyond your control. But you will still be able to look and see your patient in the eye and say that I did the best that could be done. We should not make the excuse that some things are way beyond our control, so everything is beyond our control. There are always some things which are well within our control. A good professional is able to communicate effectively. I use this acronym AWARE. You announce your presence. You come in, you say, I'm so-and-so. As it is so much apprehension when a patient comes to a dentist, there is what we call the fear of the unknown. So now if I have an unknown person taking care of me, it adds to my fear, compounds it. So the very first thing I do to put people at ease is to tell them who I am. I welcome the patient in, make them feel comfortable. I ask if there's anything that they want me to know before I start giving them an explanation. I review what they have told me and then tell them what is the next plan or what is the next step that is going to be taken. And I exit with something which they will remember. If you remember any encounter of yours where you are a patient or you have gone with a family member to a doctor, you will remember this is the first thing he said to me. This is the last thing they said to me. You as healthcare professionals have an impact not on just the lives of your patient, you have an impact on the lives of even their family members. Every word you speak is recalled, replayed. So let's make those words which we speak good, and some things that bring out good vibes in people. So this is a point very much emphasized in this book on maxillofacial surgery, which is a good professional communicates effectively. And I want to read this para and give you a an example from my own life. A patient will go out of their way to seek out a doctor who has excellent communication skills. The professional takes time to explain treatment options, makes recommendations, clearly states financial arrangements, and predicted expected completion of the treatment. This in turn empowers the patient to accept treatment plans and make appropriate treatment decisions. So at the end of the day, all of us have that skill set, all of us have that knowledge, but what makes a patient want to go to a particular doctor and not to anybody else? So this is what I would visualize. I was always that patients would be coming to me, would be coming to my students from far, far away. So we live in the Kingdom of Saudi Arabia. The neighboring country is Bahrain. And I would visualize that there would be patients coming across the sea to my students because they are good professionals, because they communicate effectively, because they explain things properly to their patients. So I was very happy, very delighted when once I received a message from a patient for whom I had done a wisdom tooth extraction. She had moved on to Boston, which is on the other end of the world. But the experience with the first impaction had been so good that she wanted to come back when she would come back to Saudi Arabia to have the other impaction done with me. So, and she wrote a note about she's so happy to travel 6,380 miles, which is 10,272 kilometers, to go back to the same doctor because the doctor communicates effectively. Definitely there are people in states, definitely there are people all over the place who can do that extraction, but the patient felt comfortable because these principles were followed and communication was effective. So what I visualize for you is once a patient or a family member has come to PIDC and had their treatment, even if they move to Kuala Lumpur, they will come by train, they will come by flights, they will come by road, but they will come back to you because you as a healthcare professional have changed their lives. You have changed their perception of healthcare, and you are that kinder practitioner of medicine. Good professionals or true professionals, they follow exceptional guiding principles. What are these exceptional guiding principles? One, they practice proper etiquette. They demonstrate appreciation for their employees and team members. They have high ethical and moral standards and are honest and fair in their dealings. Warren Buffett, in an interview, when he was asked, what is the qualities you look for when you're selecting somebody for your positions? He says, hard worker, intelligent, but above all, a person who is honest and has integrity. Because I do not want somebody who's a hard worker, intelligent, and is unethical. He's going to ruin all what I built over all the years. So they make everyone feel a part of the team. How do ethics and how does not being honest come into play in our field? Simply putting a wrong code is something which is unethical and is wrong, wherein you do a simple procedure, but you put the patient in a higher procedure category. And many people have been jailed and have been put in for fraud, very successful practitioners. They have all the other qualities of the skills and the knowledge set. But because of unethical practices, here of a particular dentist putting himself into trouble by demonstrating how recklessly he's done an extraction, and he was billing patients wrongly. So here's another case of billing patients wrongly, doing unnecessary procedures because of which dentists have been jailed and dentists have been fined. This test comes to all of us. Everyone in this room is put through this test where the patient completely trusts you. You can do an extraction which will cost the patient less. You can do a root canal treatment and a crown, which is going to cost the patient much more. Sometimes as a student, you need to do a root canal treatment and you need to put a crown and you need to learn, but what's in the best interest of this patient is an extraction. And as a true professional, you will choose by putting your patient first in what is their best interest. Everyone is not monitored by every faculty all the time, but we all know that we are all monitored all the time, and we need to do what is best and in the best interest of our patients. A true professional praises their peers and not themselves. They do not, if you look at this, what do you see? You see, on the one side, you would see a bird, and somebody else may see this as a rabbit. They are different perspectives. Your colleague may have done a particular procedure from a different perspective. So do not brush aside what they have done. There are more than one ways to do things, and there are more than one views to the same issue. So acknowledge what your colleague has done. Acknowledge that they may have done this also with some good interest of the patient in mind. So they demonstrate respect for their peers. And while they may not always agree with another provider's treatment, a professional should not unfairly criticize what the other colleague or other professional care provider has provided. They put the patient first. They do not hesitate to take a second opinion. If it's in the best interest of the patient to take a second opinion, they refer it. It doesn't make you in any way little if you take the opinion of another person, because your intention is to give what is best for the patient. True professionals share their knowledge. We are in healthcare. If I know of a way, if I know of a technique which would make things better for the patient, which would make things more successful, I would love to share it. This is not a business where I have some tricks up my sleeve so that my practice should be better than anybody else's practice. So there are things in healthcare which I keep to myself. We are an altruistic profession. We chose this. If you remember, your dream to be a dentist or a healthcare provider was because you wanted to make a positive difference in people's lives. You wanted to be that agent of change. And this is our opportunity. So sometimes we need to revise and re-jog our memories as to why are we here? Because we wanted to make an impact. It could be through us, or it could be through something we have shared with others. It's a far more infinite way of your good reaching far away. So as healthcare providers, we have no trade secrets. We share our knowledge. We say thank you, and we are not afraid to say I'm sorry. A professional does not have to be perfect. He does not have to do everything right all the time. They are honest, we said. So if a shortcoming is there, if an error has taken place, they do not cover it up. They acknowledge it, and they take steps to make things, or to make amends and to make things better. It's not about perfection. Professionalism is not about perfection. It is about doing things in the most appropriate way possible. And do not shy away from saying, I don't know. You would shy away from saying, I don't know, when you do not know what you need to know. But if you know what you need to know, you will not be shy of saying, I don't know. And the 10th point, keep a smile on your face and the right attitude in your heart. So a professional will not share what is going on in their lives which is affecting them on that particular day. This is the hallmark of a professional, that they are able to put things aside and give their very best to the next patient who comes in. I'd like to show a short video clip. This is just before that, saying that we are in a highly stressful profession. As students, we acknowledge that students are under a lot of stress, especially dental students have far more stresses than maybe other healthcare professional students. But we should not let our stresses, what has happened in one class, affect the next class, what has happened at home affect our patient. Because for this patient, he's come to his doctor and he is expecting that he will be given the best possible care. I'd like to show this 2-minute video, and maybe I can just talk about it after that. So we treat others how we want to be treated. So if this was me or this was my family member, how would I want that particular doctor or healthcare provider to be with me? And I think if we make this our guiding principle, we may be quite different most of the time. So when it comes to professionalism being practiced by students, it's been described in many ways as behavior, communication, and presentation of oneself. But to simplify this understanding, they have introduced three components of professionalism. One is your appearance, your behavior, and your communication. So the very first impact you make on your patient is your appearance. So it's a form of non-verbal communication. It influences the patient's initial perception about what to expect. They judge your competence by how you appear to them. So this is a well-groomed professional. So I typically have the situation where the students come, present the history to me, and it's a brief history. And when I go to the patient, in the next 2-3 minutes, this happened to me when I was 12, and this happened to me when I was 20, and this happened to me when I was 35. And the student says, Wallahi, I asked him anything is wrong. He said nothing. And now when you're talking, he's coming on and on and on with so many issues. And that's because there are some things which we are doing as professionals which are making this happen. So when somebody walks in like this, you are more likely to give him the whole history than the same person. This is exactly the same person. But we do not have this issue with the dress. But what is happening with our students is this patient does not think you are listening to them. And why does the patient think that you're not listening to them? Because you are, instead of listening to them, making notes, entering things on the iPad, and there is no eye contact. So when the patient feels that he is not being heard, he will not speak. And when you make eye contact and listen to them, they're bound to tell you everything. So it's those same 3 minutes to the students half an hour, but much more history is coming out because now the patient feels you're interested in them. So listening to them, because listen to your patient, the patient is actually telling you the diagnosis. He's giving you the diagnosis if you really listen to him out well. Make a good first impression. I would actually say not make a good first impression. I would say make a great first impression. And your first impression is made by the way you receive the patient. So it takes me the same time to smile and say, please come, and say, come. It takes me the same time, but I can make a great first impression. How are the people receiving? I think one of the most important person in an entire setup is the receptionist or the security guard. They make an impact on your practice even before the patient reaches you. And the ambience of the receiving area. So all these are small factors. So when a study was conducted, what they found out is 91% of the patients agreed that they were inspired or they were reassured by the appearance of the student. So if the student appears well, is well groomed, this gives them confidence in a dental procedure. It's giving them confidence on a psychomotor skill based on something not psychomotor at all, based on your professional appearance. And you make an impact on how they will perceive dentistry and dentists by what impact you have as a student on them. Because please be aware, this is probably one of the most scary procedures ever, most dreaded procedures ever for a patient. It's equal to this, being in a torture chamber with all those instruments laid out in front of you. And maybe it happens right from the junior level to the senior most level when a patient has a question. You're asking me? You're questioning me? I know what needs to be done. As compared to, yes, I understand your query, listen to them completely and then give a response to whatever they are concerned about. So when you are a practitioner who listens to your patient, your reputation goes far and wide that he listens to me. You may know what has to be done, but unless you listen to them completely, the patient does not feel that you understood them completely. So 88% of patients considered the student's behavior increased their comfort level. 80% agreed that the overall behavior of the dental student improves their perception of dentist in general. One of the common procedures or steps before doing any procedure is consent taking. And a consent well taken has an impact on the patient's perception of what is going to happen during the procedure. So patients sometimes are given a paper. I've corrected my students to doing this and said, please sign, this is the consent form. Do we ever sign blank papers? Do we ever sign any papers without actually reading and fully understanding what has to be done? So you start off on the wrong note when a patient is asked to sign a paper for the procedure without actually giving him time to read and explain things to him. You don't build trust. And he said, once you build trust, even if something happens during the procedure, the patient still trusts you. So 90% of the patients agreed that their chief complaint is fully heard, which is very good in terms of student information gathering. 96% were informed about the treatment options and the duration of the treatment. For us, what is well known may not be known at all to the patient. So I had this patient, they had had upper wisdom tooth removed. It was a very smooth procedure in 5 minutes. And she had come a week before her sister's wedding for removal of an impacted lower wisdom tooth. And in the process of consent taking, I told her that post this procedure, it's not like the upper one. You're going to have swelling, you're going to have all these issues. She said, thank you so much, doctor, for giving me this information, because though I waited 3 months for this appointment, I thought it's going to be like my upper one. And I will take an appointment again and come. But I don't want to be with all these issues for my sister's wedding. So somebody else doing the same procedure without the consent, without telling them what are the consequences, she would have really regretted it. So the patient did come back months later, but very happy, very glad, with trust. Now, anything you tell this patient, she is going to believe this because she trusts you now. And as a professional, you should be able to communicate both using simple words with the layperson and your patient and the technical terms with your professional colleagues. Sometimes we notice that this doesn't happen. We use terms very easily with our patients, which are very common to us and our colleagues, but they are beyond the understanding of our patients. So you must try to ensure that whenever a good professional speaks to people who are not from the field, they always simplify their language. The effect of first impression on patient confidence. 90% of the patients report that their first impression affects their confidence. So I think we really need to work on our first impressions. 89% of patients reported that the way that they were received affected their confidence. So one of the simplest things to build confidence is greeting your patient. So when you are greeting a patient or are greeted, greet in return with an even better greeting, or at least respond with the same greeting. And God takes into account everything. So my message was, especially for students, is learn for mastery, not for grades. I have not visited any clinic in the world where a student's grades have been put outside the clinic, whether they were the toppers or the first students or mid-level students. No, you are now a professional. You are somebody now who's acknowledged by everybody else to be an equal in a self-regulating environment. So do not work for grades, work for mastery of your subject. And you can, through this, earn the praise of your colleagues. You can earn the praise and respect of your teachers and the good wishes and prayers of your patients. So the two values I really want to reflect, for all of us need to reflect on and really imbibe into our practice, would be: patients remember how they were received and greeted, treat others how you would like to be treated. So let me just quickly recap, and then we can probably reflect how much of these 10 attributes are already there in us. I know many of these attributes are already there in us, and which are the others which probably we can work on to make us better professionals, true professionals. So the very first one was, we put our patients first. We do procedures which they need more than what we can offer. We make expertise our specialty. We try to find out everything that there is about our field. We do more than expected. We make expectations from us realistic before starting off on projects. Somebody in back at my place in Saudi Arabia, it's very common for patients to say, can we have a Hollywood smile? And it's marketed as a Hollywood smile. And you need to tell them that this is how close to that you can possibly get, but you are not, in all cases, going to have a Hollywood smile. Do what you say what you can do, which is part of this. Communicate effectively. I would want and I would hope and I would pray that at PIDC, you have patients coming from all over Malaysia. Maybe if there was a visitor to Penang with all its tourists from Thailand and other places, and they came here for an emergency, they will go back and they will never want to go anywhere else but come back here for a holiday and to PIDC for their next treatment. So you need to have that kind of impact on them with your effective communication. We follow exceptional guiding principles. They praise and they acknowledge the work of their colleagues and their peers, and they realize there's more than one point of view. They share their knowledge. We have no trade secrets. Our good and the good we can do, and the reason why we joined this field was to make a positive difference. So we don't keep secrets about how to help others. We don't keep secrets of ways in which we can make things better for our patients. We say thank you, and we are not afraid to say that I'm sorry. And we keep a smile on our face and the right attitude in our heart, and we try to give our very best. We do not let our personal life affect our patients' lives. So believe in yourself and try to always be better than what you were yesterday. I'd like to end with one 4-minute clip. This is from the Cleveland Clinic. It's something I would want to reflect on about that patient who comes to us with just a dental issue and is talking only about a dental issue to you. What could be running in their lives and how your words possibly impact them? Yes, a very heart-touching video for me because when I think of every patient on my chair, I think of what all can possibly happening in their lives. And this is my opportunity to make this particular meeting of theirs or this particular day of theirs different by just being a little kinder, just smiling a bit more, listening a little bit more attentively. And I can impact these patients' lives because there's so much happening in their lives which they don't tell us, which they put up a brave front. And they are not going to open themselves to anybody, but this is your opportunity, since they have entered your lives, to make a huge positive difference in their lives. Thank you. Thank you so much. I would just like to thank the Dean, Dr. Ajit Thelang, Dr. Lehri Therang, for the professionalism in their hospitality and the wonderful time I've had here. Would love to come back to Penang International Dental College. Thank you.